Hi guys, welcome to Dr. AI YouTube channel. In this video, we are going to talk about clavicle. Clavicle is a S-shaped bone and this is the only long bone which lies horizontally in our body. And also, this is the first bone that starts ossifying and it is only long bone which has two primary centers of ossification. And the special thing is generally has no medullary cavity in this bone. So now let's talk about the parts of this bone. There are three main parts of this bone as shaft, medial end and lateral end. So medial end mean it is closer to the medial axis of the body and lateral end mean it is far from the medial axis of body. So here we can see the medial end. And here lateral end. There are two diagrams of clavicle as this is the clavicle from superior view. That means the view from above. This is from inferior view. Inferior means the view from below. And as I told, this is the medial end, then this is the lateral end. And this part is called as shaft. When we talk about the medial end, it is also called as sternal end because this end articulates with the sternum. That's why it is called as sternal end. So this articulates with the clavicular notch of the manubrium. Manubrium is the uppermost part of the sternum. If we draw sternum like this upper part is called as manubrium and this notch is known as clavicular notch. So this medial end articulates with this clavicular notch and therefore this joint is known as sternoclavicular joint. Here sternum mean sternum, clavicular mean clavicle. So it is very easy to remember as sternum, clavicular, sternoclavicular joint. Okay. And this medial end is quadrangular in shape. This part is quadrangular in shape. Now let's talk about this lateral end. This end is also known as acromial end because this face articulates with the acromion of the scapula bone. Scapula is a triangular shaped bone and here this is spine and this part is known as acromion. So this face join with acromion and forms the joint acromioclavicular joint. So now let's talk about the shaft of this bone. So here this is the lateral 1/3 of the shaft and this is the medial 2/3 of the shaft. Lateral mean it is far from the medial axis. Medial mean it is closer to the medial axis. So this lateral 1/3 is flattened from above downwards. This part is flattened from above downwards. And as this is superior view, this surface is anterior. That means the front side. So it is concave forward. This surface is concave forward and this posterior or the back side is convex forward. And here the superior surface is subcutaneous. That means it is directly under the skin. It is subcutaneous. And in the inferior surface of this lateral part, there is an elevation and a ridge. Here you can see an elevation. It is called as conoid tubercle. And there's a ridge called as trapezoid ridge. You can see here a ridge. It is known as trapezoid ridge. So this is very important. It is in the inferior surface of the clavicle in lateral 1/3 of the shaft. Here the mountain shape like elevation is known as conoid tubercle and the ridge is known as trapezoid ridge. And now let's talk about the medial 2/3 of the shaft. Here it is rounded and anterior surface is convex forward. The posterior surface is smooth. And the superior surface of this medial part is rough. And in the inferior surface of the medial 2/3 of the shaft, there is an oval impression at the medial end. It is known as costal tuberosity. And there's a very important groove in this inferior surface of this clavicle. You can see here, it is known as subclavian groove. I'll give a brief idea again. So this is medial end and it is also known as sternal end as it joins with the sternum. It gets articulates with the clavicular notch of manubrium and therefore it is known as sternoclavicular joint. And lateral end, it is also known as acromial end as it articulates with acromion of the scapula. So it is known as acromioclavicular joint. And when we talk about the lateral 1/3 of this shaft, the anterior surface is concave and the posterior surface is convex and the superior surface is subcutaneous, and in the inferior surface there is an elevation and a ridge called conoid tubercle and trapezoid ridge. And here the medial 2/3, this anterior surface is convex and posterior one is smooth. The superior surface is rough and there's in inferior surface there's a costal tuberosity and oval impression, and a very important groove called as subclavian groove is also in the inferior surface of clavicle. So that's all for this clavicle bone. I think you get a clear idea about this one. So if you like this video, please hit the like button and don't forget to subscribe my channel. Thank you guys.